Good afternoon. It's been almost 13 weeks since we instituted the mandatory 14-day quarantine for all travelers entering the state of Hawaii. It's been one of the most effective measures in helping us control the spread of COVID-19. We've been working diligently to develop a multi-layered testing and screening process that would allow us to invite travelers back to the islands. We are working on an alternative to the 14-day mandatory quarantine that would allow a safe and healthy way for travelers to return to the islands. Today, I'm announcing that beginning August 1st, we will implement a pre-travel testing program for travelers to Hawaii as an alternative to the 14-day mandatory quarantine. Beginning August 1st, travelers who have a valid negative COVID-19 test prior to arriving will not be subject to the 14-day mandatory quarantine. The quarantine will remain in place for those who choose to not get a pre-travel test. The health of our community continues to be our primary focus and priority. This multi-layered health screening process allows travelers to return and allows us to continue to protect the health and safety of our community. Temperature checks and screening will continue. Anyone with a temperature over 100.4 degrees, or if they have been experiencing other symptoms, will have to go through a secondary screening process upon arrival at the airport with trained healthcare staff. They will also, at that point in time, be offered a COVID-19 test to further evaluate their symptoms. Travelers will be required to fill the State of Hawaii health form, which will be verified upon arrival. We do know this COVID pandemic has had tremendous impact on our economy. Businesses have closed. More than 200,000 residents have filed for unemployment since the beginning of this pandemic. Hawaii went from the lowest rate of unemployment in the nation to the second highest in the course of several weeks. And at the end of July, much of the federal support will no longer be available. Now is the time to work together as a community to ensure that our residents and local businesses can safely return to a larger volume of travelers. We have been working closely with many members in our community in developing this plan. With me today is Lieutenant Governor Josh Green, Senate President Ron Kouchi, and Speaker of the House Scott Saiki, who were instrumental in organizing and developing our plan. And with me today are the mayors, Mayor Mike Victorino and Kirk Caldwell, and Mayors Harry Kim and Derek Kawakami, although not present, have been a critical part of this process. They played instrumental roles as we've developed this process and the process to return inter-island travel without a quarantine. Also joining us today is Dr. Bruce Anderson from the State of Hawaii Department of Health, who has been working closely with the Lieutenant Governor and many of our community partners as we've worked to create a system that can continue to protect the health and safety of our community at the same time that we invite back additional travelers. We've all sacrificed in our community, all taken personal responsibility in this fight against COVID-19. And we are now ready to begin the process to return our economy in a safe and healthy way. People do need to get back to work, but it must be done in a way and a manner that protects the health of our community. As we take these steps to increase the number of travelers to Hawaii, we do anticipate that we will get more cases. But we have spent the last few weeks in building up our capacity to handle more COVID positive cases. We have increased testing and contact tracing capacity all across the state, which gives us confidence that with an increase in the number of COVID cases, our healthcare system will not become overwhelmed as it has been in so many communities all across the United States. We still need to take personal responsibility in this fight against COVID-19, and I certainly encourage everyone to continue the vigilance that has gotten us to be the best performing state in the country with the lowest infection rate, the lowest hospitalization rate, and the lowest fatality rate in COVID-19 across this country. So please continue to wash your hands, use hand sanitizer, wear your masks, stay home when you're sick, keep your children home when they're sick. It is so important that we continue to work together in this fight against COVID-19. So thank you for joining us this afternoon. Please remember to take care of yourself, take care of each other, and most importantly, help to take care of our community. Thank you.
Thank you, Governor. Next speaker, Lieutenant Governor Josh Green.
Hello, everyone. Thank you for having me, Gov team. As the governor's mentioned, we are now here at the point where we have a start date for our pre-arrival testing program. The program will begin on August 1st. Trans-Pacific travel, safe travels Hawaii under the governor's lead, August 1st, 2020. Now, how did we get here? Well, through the governor's strong orders, the quarantine order, 14 days, stay at home, we've been able to keep the fatalities and the illness at bay. And because of the Department of Health's diligent work constantly, we've kept the healthcare crisis at bay. We are using 47% of our ICU beds as of today, very low compared to other states. Only 17% of our ventilators are in use, and our hospitalized numbers to date are just 103, which are utterly low compared to any other state. And this has given us the opportunity to take the important move to begin to reopen our state to travelers. Now, we've been pleased to come up with a plan which has involved a lot of individuals. And to sum up the plan, here's what it looks like. A person will get a negative COVID-19 pretest, and they will not need quarantine. But they will have to have that pretest before they come to the state of Hawaii, as the governor has pointed out. And why a pretest? What will a pretest do for us? Well, it's not perfect, as we know, but a pretest will minimize the risk that COVID-19 is imported into our state. It's one import that we want least in our state. So pretesting will minimize the risk of importing COVID-19 to Hawaii. Like we've said, a test in advance will decrease the number of positive cases that come to Hawaii. How did we get to this program? Well, there are a lot of people across the world that are doing this. Alaska in particular has been guiding us. We've seen a lot of their results. We can see how it can work and how it can be improved. And because of our partnerships and the extensive teamwork we've had, and the teamwork really is extensive, of course, Governor Ige at our lead, General Hara tirelessly, Hawaiian Airlines, Avi Manis, I should single out, has been doing an extraordinary amount of work, Hawaii Pacific Health, HMSA, leadership here at DOT, DOH, Bruce and Dr. Park, HIEMA, our mayors have been instrumental, House and Senate leadership, and so many others, because this program, while seeming simple on its surface, will be complicated. It's important, however, that we have the support of the medical community. We had 700 docs write to us and ask us to do this, and knowing that we can take care of everyone made it possible. Please be assured, this is not a silver bullet, but it is another part of the multi-layered system the Department of Health has come up with to complement comprehensive tracing capacity, very important, to complement screening people for temperatures and the thermal screening, very important, and to be able to trace people constantly. That will make the difference. So we have more than 5 weeks to deliver on this plan for August 1st. You'll get many details as we go forward, obviously. Right after this press conference, our work group will be meeting just upstairs with about 15 of us, once again, to move this football down the field. So again, as the governor said, this is one layer of screening to make sure people are safe as we reopen, but keep your guard up. He's absolutely right about. Do not fail to wear masks. Masks will keep us much safer. Masks will make a difference. Continue to socially distance. Continue to care for one another like the governor says, and we'll be okay. Aloha.
Thank you, Lieutenant Governor. Our next speaker is Senate President Ronald Kochi.
Thank you. The first message I want to deliver today, I'm here because I want to show that the governor, the mayors of the 4 counties, Speaker Saiki in the House, myself in the Senate, are working together to make sure we come out with the best results for the people of Hawaii and the visitors who are going to come and enjoy our wonderful island state. This, by far and away, is the most difficult decision that I've ever had to make in my political career, to stand up and say, when I think that it is safe for us to start welcoming tourists, to try and get our business going forward, while being mindful of the health and safety of the residents of this state. I would like to thank Speaker Saiki and his committee and participating in a subgroup led by Mark Muishi of HMSA with business and health people who really gave me the kind of information that I needed as a decision maker to be able to arrive at this point. I want to thank the governor for the opportunity to serve with the committee he put together and continue to get more information to ensure what I was doing was correct. And last, I'd like to thank Senator Dela Cruz. He's the chair of the Senate's COVID-19 committee. The COVID-19 committee has done incredible work in all areas and aspects of dealing with COVID-19. But in particular, I'd like to recognize their efforts to continue to work with the DOT, Department of Health, and the private sector in continuing to improve our protocols at the airport, which is the most critical point to ensure the safety of our residents and enhance the experience of the visitors who are coming here. Again, I would echo what both the governor and lieutenant governor have said. It's creating layers of safety. We've talked about a more robust testing protocol. This plan contains that. We talked about the ability to have contact tracing. In the most recent clusters, one here on Oahu, the Department of Health was literally out knocking door to door, interviewing people for close contacts, administering tests where necessary, and more recently on the island of Kauai, part of my senatorial district, after over 40 days of no positive tests, to get a cluster, and within a matter of days, the contact tracing had been completed. Almost 100 tests had been administered to close contacts. And I'm thrilled to say through today, there have been no more new positives. I hope that we have earned your trust and your confidence in the way that we have executed the plan that we've laid out before you, that we have hired the right people, deployed them in the correct way, and we want to ensure that everything was done with your safety utmost. So thank you very much for allowing me to be here today.
Thank you, Senate President. Next speaker is House Speaker Scott Saiki.
Thank you very much. I just hope that the cameras captured this visual behind me, because this is somewhat of an unprecedented group of people. What you have here today are not just state and county officials, but also members from the private sector. This team has worked really hard over the past few months to get to this point, and I just wanted to acknowledge all of them for their work. The Senate President and I just wanted to assure the general public that as travel begins to incrementally reopen in Hawaii, that our top priority is the health and safety of all of our residents. And that's why on Friday, the legislature is poised to approve legislation, Senate Bill 126, that will appropriate $90 million for health and safety protocols at the state airports. These funds would be used to provide a thermal screening program at the airports, as well as a web-based traveler application system screening and testing facilities and supplies for our airport officials. We wanted to really reiterate again to the public that we know that there is some trepidation on the part of residents as we begin to reopen travel, but we are doing everything possible to ensure the safety of all of our residents as we begin to reopen the airports. Thank you very much.
Here, our next speaker is Mayor Mike Victorino, Maui County.
Mahalo. Mahalo, Governor, Lieutenant Governor, and all the rest of you state officials who've allowed me this opportunity to speak to the people. I speak to the Maui people every day at 4 o'clock. So today I'm going to take this opportunity to speak to them real quickly and speak to the rest of the state. I've been a strong advocate that the base of this recovery must ensure that our residents are priority. Nowhere else that I can say that we have an opportunity to show that we can control a pandemic like we have here in Hawaii. I can tell you, on March 24th of this year, we had 9 cases on Maui. By April 30th of this year, we had 115. Since then, we have had 122. 7 new cases in 45 days. Not as good as Kauai, but where we were and where we are, we have done an amazing job. And when I say we, I'm talking about the people. So I have to thank the people of Hawaii and the people of Maui and Maui County for their diligence, their vigilance in making sure the pandemic did not spread. And because of them, we are where we are today. The policies the governor and the mayors throughout the counties really made a difference. But if people don't follow, if there's a lot of knuckleheads out there, guess what? It doesn't happen. And I've used that and I've coined that phrase, knuckleheads. We don't have many of them, but now we know what real good people mean to Hawaii. So we're at a good point, and this is why I support the reopening, but all of the testing and other procedures and policies must be in place, and we, the people of Hawaii, must meet it, must continue to develop this. But most importantly, people want to come to safe destinations, and Hawaii right now is considered a very safe destination. So people who are healthy want to come to a healthy place. So let's keep it that way, ladies and gentlemen. You, the people, have the opportunity to make the difference. We can reopen our economy, diversify, as many of us are discussing right now. But most importantly, we can make Maui and Hawaii no Kauai. Mahalo.
Thank you, Mayor Victorino. Next speaker is Mayor Kirk Caldwell, City and County of Honolulu.
Good afternoon and aloha. It's so quiet. In a terminal, you know, in January and February, bustling with noise and lines out the door here in the lobby of Hawaiian Airlines. And I hope this is the beginning of a bustling terminal again. We need to return to welcoming visitors to our shores. You know, for the state of Hawaii, we have approximately 240,000 unemployed people. And in the island of Oahu, well over 100,000. And while we've been opening up the economy and on Oahu, thawing out our different sectors, and almost everything is now open in one way or another, including singing in bars and restaurants. But we're not going to see a return to a level of employment that we had before unless we open up to visitors. And that's what this is about today. You know, the governor, along with the mayors, lieutenant governor, and others over the past couple weeks have been talking about a date to work towards opening up. And there's been a lot of discussions and disagreements. Yesterday, we had a marathon meeting about 4 hours where a decision was made to set the date of August 1st to welcome visitors back to our shores with aloha. And now it's game on. It's game on. We all have to make sure that we do our part. And I think all of us would admit that we have our concerns as we open up. one of our major markets is the West Coast, and we see the number of cases in California and other Western states surging. And yet we're going to be welcoming visitors from those states in the very near future. And we see some upticks even on the eastern states, another strong market. There's two entities that we put our trust into. One is Department of Transportation for the state of Hawaii. And two people who aren't here, one Ford Fujigami and Wes Yunamine, are not in this room because they're working their butts off in this airport already dealing with the incoming passengers and making sure that we have a robust, accurate data system in place, which is happening right now by welcoming inter-island travel. It's a great thing that the governor did, because you get a chance to work it out here at this airport, the AKI International Airport, and the other airports, before you open it up to visitors who may be bringing the virus with them. And the other critical department is Department of Health, and Dr. Anderson here. You know, we've pushed hard to make sure we have robust testing, and I think we have that capacity. Contact tracing is critical at this point. An army of contact tracers, which have been assured will be in place by August 1st. So as visitors come here, and if the virus is passed on to those who are working in this industry, there can be contact tracing, finding out who is sick. They're quarantined and isolated and supported where necessary. And if we can do that, we can deal with an uptick in cases. We can live with the virus and make sure that the rest of us can get on with our lives and living the lives where we're making the income we need to support our families. So I want to thank the governor for pushing us, prodding us. I want to thank our fellow mayors for their hard questions they've asked. Their responsibilities to the communities on each of their islands, that they be safe and healthy. I want to thank the Lieutenant Governor. I want to thank the private sector guys who are here today. Guys like Peter Ingram of Hawaiian, Ray Varr of Hawaii Pacific Health, Peter Ho, Dr. Muga Ishii, they were all part of supporting the decision makers in making this critical decision to get back to a new normal. With that, thank you very much. Mahalo and aloha.
Thank you, Mayor. And our final speaker is Bruce Anderson, Director, Department of Health.
Good afternoon, everyone. I'm going to be giving a very brief, what seems like a daily case report, and then elaborate on what the governor mentioned and Mayor Caldwell mentioned on our state of readiness as it exists today. Today, we reported 16 new cases of COVID in Hawaii. 2 are residents who are out of state. They happen to be in Nevada and Arizona, where there's a lot of illness occurring. They're there now and in isolation. 13 live on Oahu, and 1 lives on the Big Island. At least 6 of the cases here on Oahu were the result of our contact tracing, our identification of the cases and those who they were in close contact with, which I think exemplifies the efforts that are being made in this area. Hawaii continues to be in the enviable position as the state with the lowest number of cases per capita and the lowest number of deaths in the nation. Today, we had 38,000 cases of COVID in the United States. California alone had 7,000, more than 7,000 cases. Florida had over 5,000. Texas had over 6,000. We had 16. I think it's a tribute to a lot of efforts that are being made, and also exemplifies that we have been able to respond. Unlike many parts of the nation where the disease is raging, I see most people wearing masks at grocery stores, takeout food establishments, and standing 6 feet apart as they wait their turn. Businesses are renovating work areas to provide for physical distancing, installing plexiglass barriers, staggering work hours, and taking other actions to work safely. There are not many knuckleheads around that I see. Everyone in the state is working hard to keep our case numbers down. And we've seen great results because of that, and I appreciate all of your kukua. The 14-day quarantine on travelers has given our state the time to build our infrastructure, obtain personal protective equipment and other necessary resources, and to prepare effectively and efficiently to handle more cases. The Department of Health now has nearly 200 cross-trained employees through the state who may act as contact tracers in the event of a surge in cases. And in addition, the University of Hawaii is training another 300 applicants who will be able to assist with contact tracing by the end of July. Each of these individuals is able to track 20 people with the new applications that we have in place now. Many of the recently reported cases were uncovered through timely and intensive investigations by our contact tracing staff. Clusters of cases have been quickly contained through isolation and quarantine measures. Outreach activities in at-risk communities and care homes throughout the state have also helped in proactively identifying cases and increasing prevention measures. We have seen a spike in the number of cases over the last 2 weeks here, but nothing like what's occurred in other states. As the governor mentioned, we expect to see more cases as business reopen and more people move about. Today, we are much more confident in our ability to monitor for new cases and to respond quickly and appropriately to new cases than when this outbreak started. Our testing capacity at the 13 local laboratories within the state is between 4,000 and 5,000 tests per day. The turnaround time for tests within the state is usually within the same day on Oahu and the next day for the neighbor islands. When we started this outbreak, it took almost a week to get results often. We've seen a tremendous increase in laboratory capacity, and that's growing. Our state is currently using only about 25% of our available capacity for COVID-19 because illness rates are low at this time, but we have considerably more that we can bring to bear on the problems. This means we are prepared should we see a surge in cases or a large outbreak. Extensive testing has already been done in some care homes, medical facilities, family households, and that have positive cases, which has helped in identifying additional cases and isolate and quarantine individuals quickly. We realize that special circumstances can require isolation and quarantine to prevent the spread of disease, particularly in large families and congregate settings, such as care homes, prisons, and so forth. And facilities have been identified and established on all islands for this purpose. It's daunting to see the numbers of cases and deaths in many other larger states and the challenges that their healthcare systems are facing. We have been cautiously watching and learning from those states, including those in Alaska. The screening program we will be establishing at airports statewide will be the first of its kind for Hawaii. It is unprecedented, and we are on uncharted territory. There are certainly more details to be worked out, but we will have the opportunity to learn from other states and with our partners in the transportation and visitor industry. The airport screening and pre-travel testing program is just one small part of a statewide strategy to control and contain coronavirus in Hawaii. Perhaps the most important thing to remember is the most effective way to prevent the spread of the disease is for everyone to continue physical distancing, wearing masks when close to others, avoiding crowded places, and regular hand washing. That's what prevents the disease from spreading. It's also critical that people stay at home when they're sick, self-isolate, and call ahead to a doctor when they want to make an appointment. Closing, I want to appreciate the efforts of the people of Hawaii for staying the course and running this marathon as the governor's described it. We will continue to provide guidance, work with our partners in preventing the spread of COVID, and sharing information when it's available. Thank you very much.
Thank you, Dr. Anderson. And with that, we'll open it up to questions from our reporters here at the airport, as well as on our Facebook Live on our neighbor islands, as well as at other news organizations on Oahu. We'd like to remind you that Attorney General Claire Connors is also here for question and answer, Recovery Navigator Alan Oshima, DOT spokesperson Tim Sakahara, as well as Peter Ho from Bank of Hawaii, Peter Ingram, Hawaiian Airlines, Dr. Mark Mugiishi, HMSA, and Ray Vara, Hawaii Pacific Health. And with that, we begin with Ben Gutierrez at Hawaii News Now. Ben.
Question for Governor and or Lieutenant Governor. Alaska has been cited as an example that Hawaii is following. One of the options that they have is allowing for testing at the airport for arriving passengers. And second, they also say that any COVID test that is taken before arrival must be taken within 72 hours, or at least the results within 72 hours. So how far ahead, or what's the time frame as far as when people have to have that test taken before getting to Hawaii?
Certainly, we are looking at the same 72-hour lead time for the test. We think that that's a reasonable target to head toward. And we are working through the details of what would be required in terms of that test. We have engaged with, I've talked personally with Governor Dunleavy of Alaska, and we've been discussing this travel corridor with them. The whole notion of testing, of arriving without taking the test and getting testing upon arrival just doesn't work for us here in the state of Hawaii. Clearly, it would be taking testing capacity away from our community and really focusing that on visitors' arrivals here. The volume of visitors that we get in Hawaii is significantly greater, about 10 times, than the volume of visitors in the state of Alaska. And clearly, that would put an undue burden on the local testing capacity here. I don't know.
Our next speaker, Manolo Morales.
I'm going to add something. The governor was right on the mark. Alaska is informing us very well. We've also had the opportunity, Dr. Anderson and I have had the opportunity to talk to Ann Zink, who's the Chief Medical Officer of Alaska, give you some details that we're learning. For instance, in the first 7 days that Alaska launched its program, which is essentially a pre-test to enter safely, they also did end up having to test some individuals. We're emphasizing pre-testing before, but of those individuals they tested 4,800 individuals, and 13 of them were positive. That means 1 out of 376 individuals that had traveled had been asymptomatic travelers. And this is very good information, asymptomatic positive COVID travelers. It's very good information for us to know here in Hawaii and nationwide, because we know then the value of having a pre-test traveling program. We know that we can, by testing in advance and people not traveling here as positives, stay home, we could decrease very significantly the number. If we get 15,000 travelers, you can imagine that we would stop 40 individuals from traveling here positive. So we're learning a lot of lessons, and we're learning best how to make sure we have a seamless program and what we'll have to invest.
Manolo Morales, KHON2.
Lieutenant Governor, I guess speaking, how do you verify these test results to make sure that they are what they should be, as well as how does this all apply for Hawaii residents who travel out? I mean, if they go to the mainland for like 3 to 4 days, can they get tested here before they leave here?
Great questions. Okay, so first of all, verification. One of the things that we've been lucky enough to do is to have partners, for instance, like Dr. Mark Mugaishi, who at HMSA has done a lot of work with CVS. So we reached out to CVS and we asked, could you set up a national program by which the state of Hawaii would be able to get a test reliably 3 days or so before they traveled? They said, we'll work on it. They have 1,400 places across the country, and the benefit when CVS does the test, and we will court all other partners and people's private physicians, as the governor has mentioned, by having that large partner, they have a large database, we will have a fee applied, and we can access legitimized information. Also, we can get guarantees through contracts that will basically make sure that if someone gets a test, we can get the result. We don't expect a lot of fraud, and we do have a strong attorney general to deal with that fraud. The essence is responsible travel, and by having a large partner, and we expect other large partners to come on board, we'll be able to get tests across the country. But we're not playing around here. We are telling people, get your test before you come here to keep the numbers very low so the Department of Health can do their job. Finally, you said about how do we do it with locals. Our residents who might just go for a 3 or 5 day trip, there are already protocols being developed, because it will not be sensible if someone just goes for 2 days to the mainland and have them get a test immediately at the airport or the moment they land. So protocols have been discussed. Alaska, for instance, is asking for people to get a test 3 to 4 days after they return, and to essentially lay low until they've got that negative test. It, again, will not be perfect, but it will greatly reduce the number of cases, and that's what we're about.
Thank you, Lieutenant Governor. Before we move on to Allison Schaefers, we have a question from Sherry Bracken, KWXS Radio on the Big Island. She asks, this is for Dr. Anderson, excuse me. Some of the travelers coming here who require quarantine stay with island residents who do not quarantine, even though they are in close ongoing contact with those visitors. Several island residents have expressed concern about this as a means to spread the virus. Is that a concern? Can the virus spread from an infected traveler to a local resident who is living with them and then coming and going from a residence where the visitor is staying? If so, what is the remedy?
It's often the case where we have a traveler who's staying with a local resident, and in those situations we would require that the traveler essentially isolate themselves, that they have their own bedroom and bathroom and have meals delivered. It's, of course, difficult to do that in large families, but having said that, that's one of the conditions of allowing an individual to stay with you and not be subject to the quarantine provisions. Otherwise, the household member would be subject to the quarantine provisions. But unfortunately, we haven't had any situations that I'm aware of where a traveler has infected other household members insofar as they've complied with the isolation requirements that we have.
Thank you, Dr. Anderson. Allison Schaefer, Star Advertiser.
So I just wanted to find out, we know that some COVID-19 cases will slip through the cracks despite the testing, screening, and contact tracing. What threshold of new cases would halt this testing program from allowing out-of-state passengers to exempt the quarantine or cause other lockdowns to be implemented again? Governor Bruce, I'm not sure who would be best to answer.
Yeah. Certainly, thank you for that question. We've had a lot of conversations with Dr. Park and Dr. Anderson about what would trigger, and the notion generally that we've talked about is a doubling in the number of new cases each week for 2 consecutive incubation periods. So essentially, it would end up having to be a doubling and doubling and doubling and doubling over a 4-week period. And clearly, we would be monitoring and observing what that looks like. In addition, we do have contact with each of the healthcare facilities here in the islands, and we've established that discussion about if they can help us monitor the status in their facilities and be willing to work with us in observing the conditions that they see on the front lines, and then raise their hands when they see signs of caution, and then obviously when they see signs where we should stop or take a step back. We asked them if there was an objective, measurable determinant that they could identify, and clearly we all know that a hospital or a healthcare facility is a complex facility, and clearly having a single measurable determinant is just not as simple as it sounds. So they agreed to work with us. We'll be polling them every single day. And as we see multiple facilities raise the level of concern, then we would be taking that back to the community.
Okay, thank you, Governor.
Thank you, Governor. This is from Audrey McAvoy, Associated Press. Hold on just a second. Okay, there we go. Governor, did you announce this plan today because the U.S. Department of Justice filed a statement of interest in a lawsuit challenging the quarantine?
No, I think as all of you have been asking me repeatedly for at least the last 2 weeks to really name a date, it clearly wasn't because of something that got filed just yesterday. I think all of us was committed and understood the importance, especially to our business community, of allowing sufficient lead time so all of the activities necessary to get prepared for August 1 can take place. And so certainly I think this announcement may have an impact in the case, although we believe that it doesn't have any merit in general. We'll continue to fight for the right to keep our community safe by taking the emergency actions that I and the mayors believe is in the best interest of our community to keep our community safe and healthy.
Governor, one more question. This is from Rick Kwan, KITV4. When would you envision finally lifting the 14-day quarantine overall?
Certainly we continue to monitor the virus activity across the country and around the world. And so at the point that we get a vaccine that can be distributed so that we can develop the herd immunity that is required by our community, or as we see the advances in therapeutic treatments of the disease, and we can get to the point that the healthcare community feels like we can treat those with COVID-19 in a safe manner. I mean, I think that those are the conditions that would change the requirements for the 14-day mandatory quarantine. As you've seen, especially the epicenter of the virus outbreak has moved from the northeast to the west and the south. You know, we see record cases in California, Texas, Florida, Arizona, which shows that the virus continues to thrive in those communities, and it all has an impact on travel to Hawaii.
Thank you, Governor. Next reporter is Ryan Finnerty from Hawaii Public Radio.
For Attorney General Connors. I know there were a lot of concerns about any state government's authority to regulate interstate travel. How did you address those concerns in this plan? Specifically, there was a thought that maybe the airlines would have to do it rather than officials from the state check the tests and that sort of thing. Was that a concern in rolling out this plan?
Everything that we have done, working alongside the other agencies, working alongside the counties, the corporation counties, has taken into account and has continually addressed all the legal ramifications, including the constitutional ramifications that have been discussed and addressed in various pleadings. So we believe that everything that the governor has done is well within the emergency authority that is set forth in 127A. There is nothing violative of anybody's rights. This is a set of policies and has been a set of policies that is applied consistently for all travelers. The virus doesn't discriminate, neither do any of the policies that the governor has instituted in collaboration with many of the people here. So we've been aware of all the various legal arguments. We've drilled down on them, and we don't believe we have violated any constitutional or other statutes.
And I don't know if you know this, but will it be the airlines that are checking the tests, or will that be state officers, National Guard?
In terms of verifying the test?
Yeah.
We want it to be our state officials. This is going to be a state rollout. We have partners throughout who we have been working closely with to ensure that all the different practical aspects are worked through, but ultimately this will be a process that the state of Hawaii will be verifying.
And is the legal challenge that's ongoing right now, does that potentially have any bearing on this program? I know it's regarding the emergency declarations.
No, it doesn't at all. In fact, if Mr. Price had the courtesy of reaching out to me prior to filing his pleading yesterday, I would have explained to him everything that we've been working on over the last few weeks, but he chose instead to be at odds, and so therefore now we'll see him in court. But obviously, everything that we have done, as demonstrated by the prior question, is consistent with a very deliberate, careful, legally sound way of moving our state collectively through this pandemic.
Thank you.
Next question is from Kehau Surizo from the Maui News. This is for Governor or Dr. Anderson. In light of the states you mentioned with high cases, will any extra precautions be taken for people traveling to or from high-risk areas?
You know, a couple of things. Obviously, if people ask me for recommendations about traveling from Hawaii into any of those high activity states, I tell them don't do it, right? I mean, we've reminded all travelers that really they should only do essential travel at this point in time, especially into those states with high virus activity. You know, we are looking at, but there's no simple way for us. We do believe if someone can get screened and take a PCR test 72 hours before traveling to the state of Hawaii, that does provide us an added layer of screening so that we can reduce the risk, the health risk to our community. And we're satisfied that we can create a process that would allow us to do that.
Thank you, Governor. Next reporter is Eleni Gill from Civil Beat. Eleni?
Aloha, my question is for the governor. Louder, okay.
Yeah, you don't have to be close.
All right. Oh, sorry, okay. How will people be able to get tested if they don't have symptoms or a doctor who suspects the person has COVID-19? Coming to Hawaii isn't a criterion for getting tested, is it?
So we have been working with the private sector partners. I don't know if Lieutenant Governor wants to speak, but we are, as part of this effort, establishing a business or a B2B kind of relationship with these organizations and asking them to be able to administer a test to anyone who wants to travel, who requests it. So that's part of the effort.
Well, I think I've kind of hit it right on the head. There's a couple additional things. So CVS has this B2B program. That means business to business. So they've already established a process with a price so that individuals simply pay that price. They're finalizing the cost for us now, and it'll be just done. Now, there's other states that are also offering tests as we speak to all of their residents. It's quite extraordinary to watch New York and California begin to test large numbers of people with PCR testing. So there's going to be increasing capacity. And one other thing we didn't point out, because we're going to get into the details in the coming weeks about this program, each and every week, testing becomes a little bit more innovative. There are more tests that get approved. We will be promoting whatever is the most effective, meaning sensitive and specific tests. They're also the least expensive. So as technology improves and it speeds up the process, we'll be able to get closer to the time people travel, right before they travel, hopefully, if it's very rapid testing that works, and also less costly. But before long, people all across the globe, in my opinion, are going to be getting tested, because that's become a large piece of dealing with COVID-19. But none of that replaces the things that Dr. Anderson said, which is using a mask, social distancing, and washing hands still is by far the best thing people can do. We just want to make sure they're negative before they come to Hawaii.
Thank you, Lieutenant Governor. Next question is from Wendy Osher, Maui Now, for Governor Ige. She says, you had mentioned in the past that you were in discussions to establish travel bubbles or corridors to specific destinations with caseloads similar to Hawaii's. Is this discussion still underway?
Yes, certainly we continue to have discussions with Japan, South Korea, New Zealand, and Australia in establishing travel bubbles. You know, those are government-to-government negotiations to begin to establish those travel bubbles. I just would want to note that one of the challenges for us is the fact that we are part of the U.S., and the United States, certainly the virus activity continues to increase virtually uncontrolled in many of the states. So getting a country to treat Hawaii separate from the rest of the other states is certainly a step that we have to take. We've initiated discussions with the State Department here in the U.S., as well as the governments that I talked about, to begin to establish the travel bubbles so that we can bring more visitors to the islands.
Thank you very much, Governor. Tim Hurley, Star Advertiser, your question is for?
Lieutenant Governor Green and maybe Bruce Anderson.
Lieutenant Governor Green and possibly Dr. Anderson.
Dr. Anderson. There's a new insurance industry report that looked at number of hospital beds and physicians per 1,000 people, and it ranked Hawaii among the least prepared for another wave of cases. What's your reaction to that?
Well, that's interesting. So we know that we've had a chronic shortage of healthcare professionals. However, in this case, it's something extraordinary that's occurred, which is to say, 3 months ago, when the governor convened all of us and asked us to put all of our heads together, we found ways to, number one, prepare to screen out cases of COVID and keep the cases very low. So we only have less than a handful of individuals that are on a ventilator at any time, even though we've had 476 or so ventilators available, one. Two, we have other capacity. Our intensive care units are able to surge 30% at moment's notice if we really had to. And that's before we even lean very heavily on General Hara's team, which can set up 200-bed hospitals. We've also trained, as you know from Dr. Anderson, a fleet of additional tracers. The key to dealing with COVID is simply to preventing spread of the disease. That's the most important thing, and we've succeeded. But we actually have enough and a surplus of emergency room docs like myself and surgical wards and so on. What you've seen with COVID, and this is not all good news, is that we've seen a large drop in the utilization of hospitals. So hospitals have been, for the last 3 months, very empty emergency departments have been very empty. A lot of doctors and nurses have been sitting on the sideline waiting to get involved and take care of people. So I think actually we're very, very well equipped. But what you also did see in Texas today was a big surge, which is very, very scary for them. They're overwhelming their healthcare system. I think we're completely prepared. We have seen utterly low numbers, and that's why the governor has been able to instruct all of us to begin this plan.
Thank you, Lieutenant Governor. And now Director Anderson.
Tim, let me add a little more substance to the good answer that Lieutenant Governor mentioned. And certainly it's important, as the governor pointed out, that we have the capacity and personal protective equipment to handle coronavirus cases. We currently have 23 hospitalized COVID cases. 6 of these are intensive care units and 3 cases on ventilators. That's today. Our ICU bed capacity is just over 50%. So we have lots of reserve capacity in our ICU beds, which is very important. Some of the acute care beds can actually be converted in a surge situation to ICU beds, but having said that, we have plenty of capacity there. Our hospitals have about a 50-day supply of protective equipment. That's a lot of masks, gloves, and gowns, and face shields, at least based on their current burn rate. And we are going to be watching these numbers very carefully. As the governor pointed out, making sure that our healthcare system is ready and able to handle surges is critical to our decisions to allow visitors to come. We certainly don't want them to be overwhelmed and access to healthcare be compromised as it is in some of the states now that are struggling with this issue. Thank you.
Thank you, Dr. Anderson. Yes, absolutely. Senate President.
Since Mayor Kawakami isn't here personally to speak, every time he speaks, he makes it very clear. One of the reasons why Kauai put in some of the strictest protocols early on is because of that very concern of the limited capacity on the island of Kauai. Certainly for Molokai and Lanai, it would also be a great challenge for capacity, but also the lowest rates have been there. The smaller communities have been very careful to follow all of the right things to ensure that we don't overwhelm our system. And I would be remiss if I didn't acknowledge Ray Vara from HPH and our state hospitals. We have Samuel Mahilona and Kauai Veterans on the island of Kauai, and during this period there has been an unprecedented cooperation between all of the healthcare systems, sharing responsibilities, pooling resources to make sure we don't get overwhelmed. But that's why the governor has worked individually with each of the mayors, because each island has their own separate issues and the concerns about making sure that we can keep each of the residents safe, since we are an island state as opposed to one contiguous state like on the mainland.
Thank you very much, President Cote. We're going to open it up to repeat questions from our reporters here at the airport, but we have one for Governor. This is from Audrey McAvoy, Associated Press. She's asking, many travelers will likely arrive from the states where mask wearing is not mandated. What will Hawaii do to inform travelers of Hawaii's mask wearing rules?
You know, certainly we do intend to work with the airline and all of our travel partners to make it very clear about what the health mandates and precautions are here in the islands. I do know that all of the airlines are requiring masks during flights. And again, I do think that we'll be working with our travel partners to re-emphasize that masks are a requirement here in the islands, and that it is an important part of our multi-layered screening process to keep our community healthy and safe.
Thank you very much, Governor. Ben Gutierrez has another question, HNN.
It might be for the governor, but let's see who does this. We were mentioning Kauai a little bit earlier, and Facebook CEO Mark Zuckerberg has a home on Kauai, and supposedly on social media he's been spotted at a bar in Kauai, and it's unclear when he arrived. Could he be breaking quarantine, and if so, will the state be following up on this?
Actually, he's been on Kauai for quite some time, and I was getting reports from the people who were delivering the food to the residents as far as all of the local products that he was purchasing, he and his wife and his family, and they were very clear to maintain the 14-day quarantine before they left the residents to move about the island. And we certainly are appreciative to the $1 million contribution to the Hawaii Community Foundation to help in our efforts in dealing with COVID-19.
Thanks, Mr. President.
Thank you very much. Ryan Finnerty, HPR.
For the governor.
For Governor.
Governor, could you just respond briefly to the letter sent by the ACLU of Hawaii yesterday expressing concern about the use of facial recognition technology in the airport thermal screening program?
Yes, certainly. I didn't have a chance to review the letter, but let me just talk generally. We definitely are aware of the concerns of use of facial recognition in any of the systems that we do employ and intend to implement. Just really wanted to remind everyone that no one would have access to any of the data that is contained within the system. The faces would be recognized, but there is no identification that is tied into the system. It would really be only so that we could, if someone has a temperature above 100.4, we would capture that face, and as they walk through the airport, we would be able to identify them at a checkpoint so that we can do the secondary screening. So at no time is their identity available within the system. And then the systems maintain that image for a maximum of 30 minutes, and then it's deleted. And there's no way to extract the data out of that system. So, we'll continue to look at the concerns raised by many in our community. We do take our privacy very seriously in the state of Hawaii, and certainly would not be looking to implement a system that we believed was a violation of one's privacy.
And do you envision that system being permanent, or is that something that would be unwound when the pandemic subsides?
Certainly we anticipate using it as part of our response to COVID-19. It's hard to say, what the future would entail. Obviously, this is a specific application. Thermal screening, as temperature and a fever is part of the identifying symptoms of COVID-19, that it does apply in this case. Don't know what the applications might be in the future.
We have time for one more question. Manolo, quick one.
Okay. For the Lieutenant Governor, if you could just, I just want to follow up for residents traveling. I just want to make sure. So is the protocol, they can, if they're just gone for a few days, they can get tested when they return and then just lay low until the results are in? And also, I guess if you can address, as far as those who choose not to get tested and go in quarantine, will there be a problem in keeping up with that many who, just keeping track of them if they're under quarantine?
Well, you make some good points, Manolo. 15% of all travelers that come to the state of Hawaii are our own residents returning. And so we're very mindful that that's a population, we ourselves, that can spread COVID. That's why we're going to ask our own residents to be as responsible as possible. So I'm working on that protocol with Dr. Mugaishi and our team. We'll be working on that about 25 minutes from now. It's one of the important questions. But a follow-up test will make a lot of sense. We're also mindful of what Dr. Anderson has pointed out, which is we have a limited number of tests, though we have increased our capacity. So everything we do will be based on science and best practices. We'll lean on the CDC. We're also talking to pediatricians about the right time to test children, about time to test adolescents. We're doing a lot of thorough vetting of this process, but right now one state has recommended a test 3 to 4 days after. But if I could, please people, don't go to Las Vegas and go to bars where people aren't wearing masks and they're playing a lot of table games and spreading COVID. Don't go on vacation if you don't have to areas of high risk for a time. Help us keep our state the healthiest, safest place to be in America, and then we will have a lot less worries like that, as Manolo points out.
Thank you very much, Lieutenant Governor. Governor, closing remarks.
So I just really want to thank you for being here today. Certainly, this is the next phase in our efforts to slowly and carefully return our life here in the islands back to a more normal activity. We recognize that there are many concerns that continue in our community, and we believe that this process of pre-testing does allow us to bring travelers back to Hawaii in a way that maintains a priority on the health and safety of our community. So really wanted to thank all of you for being here. I wanted to thank all of the people of Hawaii for taking personal responsibility in this fight against COVID-19. And most importantly, want to continue to ask everyone to remain vigilant. This is a marathon. We need to continue all of the safe practices that we've learned over the past several months. Stay home when you're sick, wear a mask, maintain physical distancing from each other, avoid gatherings and crowds that could spread the virus, and most importantly, take care of yourself, take care of each other, and help us take care of our community. Thank you.